For your free e-consultation or more information about the McCollough Plastic Surgery Clinic at the world-class McCollough Institute in beautiful Gulf Shores, Alabama, simply go online to McColloughPlasticSurgery.com and download your free copy of Dr. McCollough's book, The Appearance Factor, or call 1-866-876-7600 and request your free copy of the Ultimate Consumer Information Guide to Becoming a Better You.
Hello everyone, I'm Malia Allen from the beautiful McCollough Institute of Appearance and Health, and I'm in the offices of Dr. E. Galen McCollough, who is my guest today, and I'm so excited to be back in your offices, Dr. McCollough. You know, I always like to describe you as, you know, you're this visionary, you're an author, you're an athlete, and kind of an architect for the face. I learned that about you in the last show, that you really wanted to be an architect.
I almost was an architect. I had committed to go to Georgia Tech and play football at Georgia Tech. And then Coach Bryant came along in the recruiting process and promised me a national championship ring. And so I ended up going to Alabama and got the ring. So I went into medicine actually as a second choice. But once I got into medicine and I saw that plastic surgery was a specialty, there was never any question but what I was going to spend my life doing after that.
Since our last program, it was an hour long, we go into depth, we talk about you and your wonderful athletic career and how you worked with Paul Bear Bryant. It was a fascinating story, and I kind of talked you into letting me tell that part of the story. But I have had so many men in particular come up to me and say, I love that gentleman, I love that surgeon. I watched the show from beginning to the end, and I've watched it more than one time. Have you had that kind of feedback?
We actually have. We've had women come in who tell us that their husbands called them to the TV room and said, I want you to come in here and watch this show. You've been thinking about having some work done, and I want you to come and watch this show. And so as a result, yes, the men and women have both come. It's amazing that about a third of our surgeries are performed on men. So the men out there are watching this program just as much as the ladies are. I
can tell you for sure that's a fact. Yes, they are. And they all say, you know, if I was going to have facial plastic surgery, not when, if, I would let him do it. I would have Dr. McCollough perform the surgery.
Well, I'm honored that they would say that, but I have a wonderful staff of people here, and I do think that we probably take better care of people. And we try to treat people like we'd want to be treated if we were on the other side.
You've always had a unique vision for the McCollough Institute, and that started back when you first opened your practice in Birmingham, Alabama, and you had the on-site surgical center and recovery facility, which you've duplicated here in some ways. But you've also added to that overall vision. A few years ago, you told me that, you know, Malia, I want to address the issues of the whole body, and I want to round out this practice. And you're now offering a lot more comprehensive services than you had before with the facial plastic surgery and the rejuvenation that you did before. So we'll be talking more about some of those procedures that you're now offering. But before we get to that, I want to ask you this kind of overarching question, because people ask me this all the time and I often ponder it. What is beauty, and is it more about wholeness or is it more about perfection? What do you think?
Well, I think beauty is a lot about harmony. And that's harmony whether or not it's in our lifestyle, whether we balance everything within moderation. It's also important in how we look. And beauty is not only what Da Vinci described as the perfect features, but it's how we sit, how we stand, the clothes that we wear. Are they well coordinated? Do they fit well? How we wear our hair. Do we look groomed? Do we have a pleasing smile? Our character, our weight. It's a whole group of things that when it all comes together, it's beauty. And that's what we're about, is trying to deal with the whole aspect of human beings, the mind, the body, and the spirit. And I think that James Allen said it well. We've talked about it many times. The body is the servant of the mind. And inside our mind is where our spirits live. And I think when you think that way, when you think of ourselves as being a total creation of mind, body, and spirit, it gives us a little bit different image of ourselves, and it really puts a responsibility upon us to live up to that.
That's right. And you know, I commented to you before we turned cameras on that when I feel better about myself aesthetically, I treat people differently. you know, I'm kinder. I don't know why that is. I think a lot of people would say the same thing.
I think it's confidence. When you know you look better, when you know you're presenting your best face or your best foot forward, it gives you a level of confidence that when you interact with other people, I think you're more relaxed when you do it and you're more approachable.
Right, I think so. Now we have some befores and afters because our folks at home love to see your befores and afters. Those are really good because what I love about these, and I don't know who our first person is going to be. Who's our first patient, Dr. McCollough?
John would be our first patient. John is an executive.
Okay.
And he came in and wanted to, he said he was looking a little bit beyond the years that he felt, and he wanted to have some work done. So we did a little bit of work on John. We did some work on his neck, and we lifted up his cheeks, did some work around the eyes, and took away some of the drooping skin to give him a much more youthful look. And I think we have the after results following the surgery. And John was very open about his surgery, and he actually gave me permission to talk about his case and to show his before and afters, not only on this show, but in our book. And it's the book, The Appearance Factor, that we give to all people who are interested in learning more about it. Whether or not they have us do their surgery, we give them the book so that they can learn more and ask good questions.
I really love his outcome, by the way.
Well, the important thing with these results, I hope you'll see, is that they still look natural. They look like that. What I tell my patients, that if you like the way that you looked about 12 to 15 years ago, that's what you're going to look like. You're going to look like you. You're not going to look like somebody else. And we've all seen people on television, some of the famous individuals that have had surgery and following the surgery, they don't look like themselves.
Right.
And we don't do it that way. And that's one of the things that I can assure our patients.
I think that's one of my biggest fears, you know, when it is time for you to do a little something here. You know, I don't want to, you know, you don't want your face to look so much younger than the rest of the skin on your body. So it really is all about looking a little bit more enhanced and having a more subtle result.
Well, you want to have a natural, you really want to have a natural look. And that's why if you look, you know, get the photograph out 12 to 15 years ago, pull the album down, and if you like that, that's how you're going to look after our surgeries.
So who is this?
This is Cynthia. Cynthia is a professional person who was looking a little bit older than she felt. And so she came in and wanted us to do some things to enhance her appearance, and we did some work around her eyelids. So with Cynthia, we did her upper lids. We did some work in the lower lids to take away the bags and sags. And then we took out some of the loose skin in her neck, lifted her cheeks, and if you can see, it looks like she had cheek implants. She didn't. That's just the tissue that used to be there that had fallen down into the lower face, and we repositioned it and did just a little bit of a tuck in her outer brow. So it just gives her a more youthful, a fresher, more rested appearance.
That's exactly what I was going to say. She looks more rested and bright-eyed. You know, sometimes you walk around, we had one of your patients who was on the show before, and they said, you know, I just got tired of people saying I look tired.
Denise.
Yep.
Wellman.
Right,
yeah.
right.
Yeah. This is Chris. Now, Chris had early aging. She had some heaviness around her eyes and some loose tissues around the cheeks and neck. And so she didn't need quite as much done. So you modify the operation to fit the conditions that are present in each patient. And then you can see there after the surgery that she has a fresher look and looks probably 10 or 12 years younger. And we did her eyelids first. And then we did her facelift actually on live television at a plastic surgery seminar in New Orleans. And we had 300 doctors watching me do the surgery. And I actually loved it. I had a blast. It was a lot of fun to do that. And Chris healed well, and she, as you can see, looks much younger and fresher.
Well, she's got a stunning result, certainly.
For your free e-consultation or more information about the McCollough Plastic Surgery Clinic at the world-class McCollough Institute in beautiful Gulf Shores, Alabama, simply go online to McColloughPlasticSurgery.com and download your free copy of Dr. McCollough's book, The Appearance Factor, or call 1-866-876-7600 and request your free copy of the Ultimate Consumer Information Guide to Becoming a Better You.
And welcome back. I'm Malia Allen at the McCollough Institute with Dr. Galen McCollough and one of his newest surgeons, Dr. Brentley Taylor. Dr. McCollough, before we introduce Dr. Taylor, tell me a little bit about why you brought him on.
Well, I'm happy to introduce Dr. Taylor. He's been with us a little over a year now. Right. And Dr. Taylor brings to the Gulf Coast things that have not been here before. He's one of the most highly trained plastic surgeons in this area. So he truly brings things to this area that have not been available. And we're just delighted to have him as a member of our team here.
Happy to be here.
So you grew up in Birmingham, and you graduated valedictorian of your high school.
I did.
You did. And then you went to college where?
Spring Hill College in Mobile, Alabama.
All right. So you stayed there, and then you moved on from there, and where'd you go?
University of Alabama School of Medicine, and then University of Texas Medical Branch for my plastic surgery residency.
Now, what I understand, Dr. McCollough, is that University of Texas is very competitive and difficult to get into that program.
Absolutely. But when you got the credentials that Brentley brought, it wasn't that difficult.
No?
I don't know about that. I think I was very fortunate.
Okay, so you went from there, and was that general surgery?
That was integrated plastic surgery.
Okay.
So 6 years of plastic surgery training.
Okay, and then you went from there to Atlanta? Do I have that right?
I had made a stop in Tampa
Okay.
for 1 year hand fellowship
All right.
for hand surgery.
And then you went to Atlanta.
Then I went to Atlanta,
All right.
and then my wife cut me off.
She said no more college because one of us has to pay the bills, right?
Well, she said, I'm tired of moving, and so let's wrap this up.
Let me ask you, why do all of these fellowships? Was it
Sure.
just this quest for knowledge, quest for perfection, quest for wanting to know how to do more to help more people? What was it?
Mostly the latter. I wanted to be able to go anywhere and do everything, plastic and reconstructive surgery wise. And so, I wanted to be prepared to help my patients as best as I possibly could.
What has been your most gratifying moment as a surgeon?
One of the most striking was the first cleft lip that I was involved in. You have parents who these days, most parents know beforehand, before the child is born, from the 3D or 4D ultrasounds that their baby has a cleft lip, and they're so worried about it, and understandably so. I mean, you have children,
Sure.
I do too, and your heart goes out to them because they're so worried about everything. And to see the relief on their face when you're done repairing a cleft lip, it makes it all worth it. It really does.
All worthwhile.
It does. And then, almost on a daily basis, the best way to compare it would be, how you can be sore from a workout, but it's a good sore. You have like a good burn and a good sore the next day. You feel like you got a good workout in. Surgery can be like that. You can spend a long, hard day in the OR, and you get home and your back's a little bit sore. You're very tired. Your neck's a little bit sore. But then you think about like what you did for somebody that day, and it's a good sore, like you feel good about what you did.
So we've got some incredible photographs of one of your patients, and her name is April, I believe. Dr. McCollough, why don't you set us up for this patient and tell us a little bit about the why you incorporated Dr. Taylor into the McCollough Institute, and I think she beautifully illustrates that.
April shows many of the things that we try to provide here. She had a weight reduction surgical procedure performed to make her stomach smaller. And then after she lost the 100 pounds, not only did her high blood pressure go back to normal, her diabetes was gone, and our cholesterol levels return to normal. So that's the non-surgical component that we bring here to the Institute. And then she had a lot of drooping skin. After massive weight loss, she had a lot of skin around her abdomen, her breasts were sagging, she had loose skin around her face, and so she had multiple surgical procedures, and I'll let Dr. Taylor talk about the surgical procedures that are required to correct those problems.
So what did the surgeons do first?
So there's always a choice in that matter. I like to go with what bothers my patients the most. And when you have a great deal of weight loss, the skin often does not follow the volume change quite as much as we would like it to. And so it can really be head to toe extra skin, especially the upper arms, the breast, the abdomen, and the thighs. So I like to talk to my patients and figure out what bothers them the most, what's going to help them the most.
Psychologically, what do they
and
see?
Functionally, it's definitely both.
Okay.
And it is most often both.
Okay. What was the most beneficial here? Tell me a little bit about the procedures with April.
It was an abdominoplasty and a breast lift.
And then Dr. McCollough, I believe after that, she had some other facial surgeries, did you say, or procedures done to eliminate some of the sagging skin around her neck?
Had some work done in her neck, liposuction, because even though you lose massive amounts of weight, there's some areas where the fat doesn't go away and has to be removed surgically. So a little bit of liposuction, contouring of the neck and the jaw. And those things can all be done at the same time. Dr. Taylor and I frequently do procedures where he'll be working on the below the shoulders, and I'm working on the face at the same time. And that cuts down on the cost, number one, because you only have one surgical procedure, one operating room, one anesthesia, and it also allows the patient to recover from multiple procedures at the same time. But we're careful. We don't do more than we think is wise or safe to do at any one time.
And was this patient able to recover here at the facility?
Yes. She stayed in our villa the night after with a caregiver, which is another part of our standard of care. So no shortcuts. Everything just right by the book.
And so you're able to go right out the next day and do your follow-up visits with her right here on the campus of McCollough Institute. How valuable is that, Dr. Taylor?
I love it. I know that my patients are in good hands overnight. You know, I live a couple of minutes away. I never turn my phone off. I'm lucky that my wife is a heavy sleeper because I never turn it off, and I answer it in the middle of the night if I get a call, because I want to know immediately if something is going on. We have excellent post-op caretakers. I rarely have to worry about anything. And then the next morning I get in, I put my keys up and I go right down to see them and make sure everything is going as we expect it to be.
What's one thing that Dr. McCollough has taught you in the last year that you think is invaluable?
It's hard to pin it down on one thing. I think it's overall dealing with staff and dealing with patients and dealing with other physicians with grace. I learn stuff from him, almost every day.
Just how to deal with the patients and communicate with them.
Yeah, because every patient and every physician that you're working with, it's a unique situation, but always maintaining your grace, and he's an excellent example of that.
Well, that's a great time to take a break and stay with us. We'll be right back.
To order your copy of The Appearance Factor, call 866-876-7600 or go online to McColloughPlasticSurgery.com.
And welcome back. I'm continuing my interview with Drs. Galen McCollough and Brentley Taylor. Dr. Taylor, you mentioned to me earlier about the psychological effects of your patients and how it's kind of a really cool to experience seeing that and seeing how someone walks a little taller. You know, we're going back to this picture of April who had the multiple procedures. She's standing taller, her head is more erect, more upright, her hair looks nice. What happens here?
We see this day in and day out. We have patients who are really hesitant to even come in for a consult, and they're hesitant to take pictures and go and be examined, and just you can tell that they're lacking a little bit in their self-confidence.
We talked about this before. I'm not sure what it is psychologically, but when we feel better, when we have a good hair day, or we're in shape, or, we've gotten rid of some anomaly that, was driving us crazy beforehand that kept us away from that camera. Now we feel confident and we're not as concerned about our appearance as we were before. That's the crazy part, because I know from a feminine perspective that I can look in the mirror, Dr. McCollough, and that one thing on my face, no one else sees it, but I do, right? So that bothers me. And so that hinders me from opening up and becoming the communicator maybe that I would want to be, or offering all of myself. Why is that?
But that's what we do. Those of us who do aesthetic surgery, Dr. Taylor and myself, and all of our colleagues out there, we're more than surgeons. We have to be. One of my mentors used to call this psychological surgery. And that means that you have to understand the psychology of the people who are coming for you to have the surgery if you're going to be successful at this. And we spend almost as much time working on their self-confidence and their self-image and help building them up after the surgery as we do in the preoperative period, talking about the actual incisions and sutures and that sort of thing. So it's all comprehensive in nature. And quite frankly, That's the gratifying part of it. We literally change people's lives, and you and I talked in the other show about the vanity aspect of it. This is not vanity. This is about self-pride. And to me, the vain person is the person that can't walk past a mirror without checking and making sure every hair is in place. And it interferes with their ability to perform and function in society. But the person who tries to put his or her best self forward, there's nothing vain about that. You know, that's the body's the temple of the soul. And what would you do with the temple? You'd keep it up. You'd make it want to look sparkling all the time. You would maintain it when it needed to be maintained. And if we think of the mind, body, soul, and our bodies being the temple of our soul, it puts everything in different perspective.
I've noticed time and time again, it's almost universally true. We are, each one of us, our own harshest critics. And at the same time, we all feel better and usually perform better if we do put our best foot forward.
And we don't feel like we're lacking in an area, or we have that one thing. Let's say you have this, you're afraid to turn sideways because you do have a little hump on your nose. And that almost makes me non-engaged. I'm not engaged in life. And when this is gone, it's like you said in the first show, just get over it, get rid of it, move beyond it, get the surgery, and then walk out. And now you're free and you have more confidence. Because so equally, I think people who have these anomalies, they're the ones who stop in the mirror. They're the ones who are spending so much time going, man, if I just didn't have that, I would be this. Do you hear that a lot?
We do, but you have to be a little careful because there's something called body dysmorphic syndrome, and that's the individual that's never totally pleased. For example, the best example that anyone out there can remember was Michael Jackson. And Michael suffered with body dysmorphic syndrome. He could never be satisfied, and I thought Michael looked great after the first couple of procedures, but he continued to have things done. And our responsibility as surgeons, as physicians and facial and body plastic surgeons and comprehensive plastic surgeons, our responsibility is to look at those individuals and say, no, you don't need anything else.
Right.
And the best thing sometimes that we as doctors can do for our patients is to say no. It's not easy.
That's a very, very good point. What would you add to that, Dr. Taylor?
It can be tough sometimes. I like to take care of people like I would my own family. And when you run into situations like this, I try to emphasize to the person I'm working with, if you were my wife, if you were my brother, my friend, my sister, and you had this exact same situation that you're coming to me with, I would not operate. I would never let somebody do this to a member of my family or my friends. And I think that it usually can help to hit home with them a little bit more.
For them to see yourself in a realistic perspective as other people see you.
It's not just you, this is for everyone.
Right.
And none of us are expected to be perfect.
Right.
Sometimes we think that we are, but we're all flawed. And even the most beautiful person in the world, you can find something that's not quite there. They either want to be taller, or they want to be shorter, or they want to have this or that. And our job is to keep all that in perspective.
To keep it all in perspective. We always say in my family, it's whiter teeth and fresher breath. What else do you want? It's always whiter teeth and fresher breath. There's always something right. We talked about briefly that concept of, it's about being whole. It's not about perfection. So as surgeons, and if you could both weigh in on this, when you are looking at a patient and you, like you said, you tend to see what you think they could look like, you differentiate that end before the beginning. What's your goal going in? Dr. McCollough?
Well, the goal going in is to do the right thing and not the most expedient thing. And it's also to be able to tell them what you think you can accomplish, but you also are obligated to tell your patients what you don't think can be accomplished. And that's for a happy relationship. We talked in the first show about the long-term relationships. And the way you do that is to develop a relationship based on trust. And I think that's so important. And then, the patient has to be forthcoming too, because you have to tell us some of those things that we don't need to have to drag out of you. And it's really a partnership. It's a very good partnership between the provider and the person who is having the procedures performed.
Sure, I can imagine just with something as subjective as an aesthetic, right? What looks pretty to one person is not beauty to another.
Right.
A time when you've looked at someone and said, I think this could be done, but, you know, I don't know that that would be to your advantage.
Sure. I think one of the most common places I run into that is with breast augmentation. Going too large can not give you the best aesthetic result. It can cause you neck and shoulder pain, and it can cause you complications down the road.
Right.
Okay? So one of the things I like to do is have patients bring in pictures of what their goals are, but also what they want to stay away from. Because as you said, you know, beauty is in the eye of the beholder. And I want to have a good idea of both sides of the coin of what they're going for.
So having said that, what are some of the other procedures that you do here at the McCollough Plastic Surgery Center?
Oh, I'm kind of head to toe, babies to great grandparents. So a lot of skin cancer surgeries, that's the excision and the reconstruction after removing skin cancer. Facial aesthetic procedures, cleft lip and cleft palate procedures, breast surgery, body contouring, thigh lifts, kind of on down.
Yeah, right. So tummy tucks, that sort of thing.
Yes, ma'am.
And like you said, in a lot of cases, and I guess that's a case by case, you can have multiple procedures. So if you're at home and you're watching and you think you might be a candidate for that, how would they go in and make an appointment, Dr. McCollough?
Well, the first thing to do is to give us a call or to go to our website. If you go to our website, and we'll put the website up on the screen, and we're in the process of revising the website, but there's a tremendous amount of information there. And in the upper right-hand corner of the front page is the Appearance Factor, which is our patient information book.
And I'm going to hold this up because this is a fantastic book.
And you can click on the cover and download that entire book. And that book's going to answer most any question that you might have about any procedure. It'll talk about the postoperative care. It talks in the beginning a little bit about the risks and the things that you want to be aware of. And then over toward the back of the book, we get into the other things that we offer here, the nutrition, the weight management, fitness. Even there's a chapter on grief and loss, because we see a lot of patients who have lost a loved one and they're trying to start their lives over again or start the next phase of their lives. And there are actually things that one can do to speed the grief process up. So that's a chapter in there. So I would encourage anybody to get the book, read the book, either online or we'll send you a hard copy, and then come in and see one of us. And we try to put together a reasonable treatment plan, and it might all be done at one time, or we talk about the long-term process of doing this first and then something else. And, you know, we keep cost in mind as well. We really do. We try to provide a very high quality of service and care, but to do it at a reasonable price so that it's affordable, not just to the rich and famous and wealthy. Yes, we do have some of those patients who come to see us, but you'd be surprised how many of our patients are people who work for a living and live on a budget. And they work in their surgery like they would a new car or a vacation. They save up their money for that. And so, you know, that's what makes us feel good too, is that we really do have an opportunity to change lives.
Absolutely.
I was going to ask you if you had anything to add to that.
Well, we play well together. We're often all in the OR together, and you know, it's like a little song and dance, and we're each accomplishing what we need to for the patient.
Right.
So it's a lot of fun.
Right. Closing comments, Dr. McCollough.
I can just tell you out there in the audience, if you come here, we're going to take good care of you, and we're going to do everything we can to make it as convenient and comfortable for you as possible.
So you can find everything then at the McCollough Institute for Aesthetics
Well,
and
if we
Health.
don't have it yet, we're working on it.
Well, it's wonderful to be a part of your completing this vision and this picture. I'm Malia Allen, coming to you from the McCollough Institute. Thank you so much for joining us.
For more than 3 decades, Dr. Galen McCollough has given patients the best care and results.
Well, I think beauty is a lot about harmony. The mind, the body, and the spirit. When it all comes together, It's beauty.
Now he's revealing plastic surgery secrets in a holistic guide to help everyone achieve their health and beauty goals. The gift you give yourself is informative and inspiring. For more information, visit McColloughPlasticSurgery.com.